Good morning and welcome to another edition of CCH Checkup brought to you by Caro Community Hospital. Our guest today is Amy Wagner. Amy is an assistant risk manager at Caro Community Hospital, and today we'll be talking about patient safety. Thank you for joining us, Amy.
Thanks for having me.
Alrighty, let's jump right in. Tell us what patient safety means.
Well, patient safety has really taken a front seat in healthcare. It's much more than making sure the patient doesn't trip and fall, although that is important. It's a blanket term that covers every aspect of the patient's interaction with their healthcare providers. Every step in your visit is part of the safety continuum. When you sign in at the front desk, your privacy is protected. When you register, your contact information should be updated so you can be notified of important information. When you go into the exam room, lab chair, x-ray room, whatever, there are other safeguards in place to protect you, such as bed rails, dry floors, a disinfected environment, and privacy curtains. Staff should make sure you're the right patient for the medication, treatment, test, or procedure. Even your medical record is protected for privacy and to prevent identity theft. We try to reduce the chance that harm can come to a patient by removing as many of those opportunities as possible. We revise forms so particular questions will get asked. We require frequent checks of critical pieces of equipment. We review incidents that occur as well as those that almost occur so we can look at those processes and stop something before it happens. The theme of this year's patient safety campaign is United in Safety. It's really meant to bring patients and their healthcare providers together as a team. For instance, you should ask questions like, what's my main problem? What do I need to do and why? What should I expect from a test or medication? When should I follow up if my symptoms get worse or don't get better? Never, ever assume no news is good news. If you've had any kind of test, be sure to follow up with your doctor and get the results. You can avoid medication errors by carrying a complete and updated list of your meds, including over-the-counter drugs and supplements. If you don't recognize a medicine that's given to you, double check and don't be afraid to speak up if you think you're getting the wrong one. Understand when and how to take your meds and the importance of taking them as prescribed. If you're in the hospital, include a family member or friend in the discharge process or at doctor's appointments to help you remember important information. And finally, following up with your physician after discharge is a top priority.
Alrighty, thank you for joining us today, Amy, and catching us up to speed on patient safety.
Thank you very much for having me.
And tune in next week for your next edition of CCH Checkup brought to you by Caro Community Hospital. And as always, you can find out more information online at cch-mi.org.